product. I'm closing the door for privacy. I'm doing hand hygiene. My name is Fadette, and I will be your nurse today. May I please have your first and last name?
My name is Keola Akana.
Okay, Kiana Okala. May I please have your date of birth?
12/4.
12/4. I have 12/4 here, and I have MRN number 8442515. Do you have any allergy, Mr. Okana?
No.
Okay, no non-allergy, and I don't see any allergy, Ben. Okay. Oh, I'm here to do your head to toe, Mr. Okana. Like I was saying, let me do some hand hygiene so I can put my glove on. Okay. Putting my glove on. I'm gonna start with a set of vitals.
Okay.
Okay, I'm gonna start with blood pressure. I'm gonna check to see if everything is good. I have blood pressure 98/57, and I'm gonna check your temp. And I have temperature 98.4. And I have heart rate 54, and I'm gonna check for respiration. Respiration is 22, and I'm gonna check to see if you have the pulse oximeter in, and it's secure, it's on. And I have your O2 saturation is at 92% room air. And before I look in the provided order, you had a order for oxygen via nasal cannula 2 to 5 liter. I have to titrate 2 to 5 liter to maintain saturation level greater than 92. So I'm gonna make sure you have your oxygen in, and titrate it, start at 2 liter. I'm gonna put it at 2 liter nasal cannula so you can keep up at a greater level than 92. Are you feeling it? Are you feeling okay?
Yes.
Okay. I'm gonna make sure. I noticed that you was having shortness of breath. I'm also gonna make sure the head of the bed elevated so you can be more comfortable, so you can try to breathe a little better. Okay?
Thank you.
Okay?
Yes.
Mr. O'Connor, do you know where you are right now?
Yes, I'm at Fortis Hospital.
Do you know why you're here?
Yes, I'm here for heart failure complication.
Do you know what today's date is?
Today is October 14, 2020.
Mr. O'Connor, do you have any pain?
Yes, I do have I do have pain.
Okay, on a scale of 0 to 10, what is your pain level?
It's 3. 10 is 3.
3. Where does your pain located at? You said that your pain is located at your head?
Yes.
Okay, you have a headache. Okay, what provoked your pain?
Light.
Does anything make it better?
Nothing relieves it.
Does it radiate anywhere?
No.
Okay. Alrighty, Mr. O'Connor. Well, let me start. I'm gonna look inside your eyes. I'm gonna look inside your pupil. Gonna do both sides. Both of them is round, equal, and reactive to light. Perla is present. Now I'm gonna have you look at my pen. Just look straight at my pen. Go into your nose. Okay. Accommodation, constrict. Accommodation is present. Alrighty. Now let me take a look at inside your mouth. Inside mouth is pink, moist, and all teeth look intact. Okay. Now I'm gonna pull your gown down a little bit. I'm gonna check for skin turgor. It's not taunting. I'm gonna check for your skin. It's warm and you look dry. It's warm to touch, dry. Skin look intact. The color is appropriate for ethnicity. I don't see any lesion, any wounds, or any scar. Mr. O'Connor, do you have any cough?
Yes.
You have cough. Is it productive or non-productive?
Productive.
When you come up, what color is it?
White.
White. Is it thick or thin?
Thin.
Thin. If I give you a little cup, like a little 30 ml cup. Will you fill it up or will it be like halfway?
The whole thing?
The whole thing? Okay. Well, now I'm gonna pull your gown down a little more. I'm just gonna look at your chest. I'm gonna inspect your chest. It looks symmetry. I don't see any hips and lift. Respiration is kind of like it's raising at a even level. Seem like you have irregular heartbeat and a little shallow. I'm guessing because you're having problem of shortness of breath, but we're gonna try to get you help with that, Mr. O'Connor. And now I'm gonna auscultate. I'm gonna listen to your lung sound, okay? I'm gonna listen to 8 position up front and then 10 position in the back, and then I'm gonna do the zigzag modification.
Okay.
I'm gonna start right here and then go over here, come down. Okay, I'm gonna see on this side of your lungs and then come over here, and I'm also gonna do 10 spot in the back, the zigzag, the modification. And I heard cross crackle throughout all lung sound. We're gonna try to get you to do some coughing and deep breathing to help you clear out all this, and also we have some med that can help you. And now I'm gonna start listening to your heart. I'm gonna start on your second intercostal on your right. Listen to your aortic valve, and then I'm gonna go second intercostal on your left, pulmonic valve, and your third intercostal on your left, Erb's point, and your fourth intercostal on your left, tricuspid, and I'm gonna do mid-clavicular, left intercostal, your fifth intercostal in the mid-clavicular. I'm gonna listen to the mitral valve, and I'm also gonna turn and listen with the belt. I'm gonna that's where I will find your apical pulse. I'm gonna listen to a whole full minute. Okay, I listened to a whole full minute. Apical pulse out is 65. I heard S1, S2. I didn't see any murmur, any extra heart sound. Okay, and now I'm gonna check for your pulses. Okay, I'm gonna do your brachial pulse up here bilaterally, and it's +2. I'm gonna come down. I'm gonna do your radial pulse bilaterally, and it's +2. And now I'm gonna check for your capillary refill on both of your thumb. It's less than 3 seconds. And now I'm gonna check for strength. I'm gonna pull, try to push back. I'm gonna pull, try to pull back. And now I'm gonna just grab my hand, squeeze my hand. Okay, upper extremity strength +5. Seem like you're very strong, Mr. O'Connor. Okay, and now I'm gonna pull your gown. I'm gonna inspect your belly. Your belly look flat, a little. It's flat, it's symmetry. I don't see any side of mass. Not one side is bigger than the other, and I don't see any sign of like lesion or scar on your stomach. It look the color, it look intact, skin look intact. And now I'm gonna auscultate to listen to your bowel sound. I'm gonna start on your right lower quadrant, and I'm gonna go up to right upper quadrant, and I'm gonna go on the left upper quadrant, and I'm gonna come down to left lower quadrant. And bowel sound heard on all 4 quadrants. And now I'm gonna palpate. Okay, tell me if you feel any tenderness, anything, any pain.
No.
Okay, any tenderness?
No.
Okay, I didn't feel any mass or any bulge or anything. Mr. Connor, when was the last time you went to the bathroom?
This morning.
What color was it?
It was brown.
Did you had any odor to it?
Full smelling.
Okay. What was the consistency of it?
It was watery.
Watery. Was it a big amount or a small amount?
It was large.
Large. Did you had anything to eat this morning, Mr. Ocala?
I ate breakfast this morning.
Did you eat all of it?
I can say about 60% of it.
60%. Did you had anything to drink?
Yes, I had a cup of orange juice.
Cup of orange juice. Okay. And now I'm gonna cover your belly. Gonna pull it up. Now I'm gonna inspect your genitalia. Okay, genitalia. It looks like you have no lesion, no discharge, no sore, no edema, no sign of abnormalities. Everything look intact. Mr. O'Connor, when was the last time you urinate?
I can say 8 hours ago.
8 hours ago?
Yes.
What was the color of it?
It was like amber.
Amber. Do you had any odor to it?
Strong. It had a strong ammonia.
Was it clear or cloudy?
It was clear.
What would you say the amount of it was?
I can say about 10 ml.
10 ml. When you have to go to the bathroom, do you have any pain?
I didn't have no pain.
No pain? Do you have any urgency when you have to urinate?
Not really.
How frequently do you go?
All I can say is I have decreased frequency.
Decreased frequency?
Yes.
Okay. I'm gonna look at the doctor order. It seems like you already have a fully order for you. Right after I'm done with your head to toe, we're gonna get that taken care so you can we can help you urinate and you can feel better.
Okay.
And now I'm gonna cover you, make sure you cover. Now I'm gonna go down in the lower extremity. I'm gonna look at your legs. Skin is warm to touch, it's dry, it's the color look appropriate for ethnicity. You don't have the skin look intact. But now I'm looking at your both of your lower legs. It seems like you have some edema. You have +3 edema. Okay, and also we have some medicine order for you for smile to help you with that. That's gonna help those legs that's swollen so you can go down. Okay, Mr. O'Connor?
Okay.
All right. And now I'm gonna check for your pulses on your lower extremity. And now I'm gonna do dorsalis pedis on top of your feet.
Okay.
It seems like it's +1. I'm gonna do posterior tibial +1. It's a little diminished because of the edema that you have in your legs. And now I'm also gonna check for your capillary refill on your great toes. It's a little bit more than 3 seconds, like less than 4 seconds, I would say. But we're gonna help you with that. And also I'm gonna check for strength. Gonna push, just push back. All right, and then I'm gonna pull. Just push back. It seems like you have good strength. You have +5, and now I'm gonna throw away my glove. Hand hygiene. Alrighty. Put another pair of gloves. And now I'm gonna cover you up. Make sure you're good. Mr. O'Connor, are you feeling better? Are you still having trouble breathing?
I feel better a little bit.
Okay, I'm hoping the oxygen helping you, and then me putting the head of the bed up at 45 degrees help you a little bit. And now I'm gonna go call the doctor. I have your bed is locked. Both side wells is up. The bed is at its lowest position. And I have your call light right here, right next to you. And I have your side table right next to you with all the items that you need, your water, your glasses, everything that you need. Do you need anything else, Mr. O'Connor?
No, that'll be all I can say.
Okay. I'm gonna exit the room. Do you want the door open or closed?
Can I? Oh, you can close it, please.
Okay, I'm gonna close it and throwing my glove away. I'm doing hand hygiene and I'm exiting the room. Have a good afternoon. I'll be right back. I'm gonna go call the doctor, Mr.
All right.
O'Connor.
Thank you for your help.
All righty.